The following program is a Town of Colonie television production of the William K. Sanford Town Library.
Hello everyone and welcome to Health and Wellness. My name is Paul Drezelo and I'll be your host. Today we're going to be talking about vision, but more specifically how it relates to learning. Topics such as vision-related learning difficulties and vision therapy. So to help us talk about some of these topics, we are very fortunate today to have with us Dr. Robert Fox of Fox Vision Development Center in Latham. So welcome, Dr. Fox. It's great to have you here today, obviously.
Thank you, Paul. It's a pleasure.
It's obviously very cold out today, but all right, so we're going to cover a bunch of things about vision and specifically, obviously, how it relates to learning. But to start off, I just want to get some general vision-related topics, basically. Just want to cover some of those. So what is the difference between eyesight and vision, actually? What is it from your perspective?
That's a great question because it's often the root of a lot of the confusion when it comes to how vision affects learning. Mm-hmm. Eyesight is really just clarity of vision. You know, how well you could see small details or small letters on a chart from a distance, let's say, usually 20 feet away. Mm-hmm. We often equate that with vision, but it's really not. It's just one small component. Mm-hmm. Vision encompasses much more. In fact, maybe it should really be vision process or visual processing. We have a lot of things involved. We have two eyes. They have to work together. So we have to merge these two images into one. We have to make these images clear. We have to move our eyes along the page, and then we have to understand what we're looking at. And deficits in any one of these areas can cause a problem when a child, let's say, is having to read a book and understand it. But parents may have a false sense of security because they've been told by the school nurse that the child's eyesight is fine, and what the parent hears is that, well, everything is fine with their eyes when it's really not.
Yep. So just from all of our standpoints, what is actually the difference between an ophthalmologist, an optometrist, and an optician, basically? It's the three O's.
The three O's, story of our lives. Yeah. I think any of us in the three O's have had to deal with this throughout, and it's really fine. The optician is the person you go to get the glasses made. Mm-hmm. So that's sort of the end stage you end up at after you end up with when you get a prescription from one of the other eye doctors. Yep. Okay. Mm-hmm. The ophthalmologist is really your eye surgeon. Okay. They're really trained, and the huge amount of their training is really on diseases and surgery and surgical medical management of eye disorders. Okay. So they're really the medical expert when it comes to treating the eye and the area around it. The optometrist is really, he's a doctor of optometry. He's trained in the diagnosing of various vision disorders, and it also is also trained and licensed to treat them using glasses, contact lenses, and as we're going to talk more later about vision therapy. Mm-hmm.
Okay, just to make it clear, you're on the optometrist area.
I'm an optometrist, correct, and proud of it.
Generally speaking, no matter what the age, I guess, how often should someone have an eye exam just to get at the eyesight part of it, just at basic level? How often should people come to?
Well, again, it really depends on the age. Mm-hmm. Most adults between the age of 20 and 40, let's say, probably do well going every other year. Okay. But for children, things change really quickly. There's a big difference between a 6-year-old and a 7-year-old, or 8-year-old and a 10-year-old. So we really recommend that children get seen once a year, that it really should be part of your back-to-school routine. that you're checking to make sure they have good shoes that fit and they have their book bags and everything. That's a good time to make sure that their eyes are fine and ready for school as well.
Just out of curiosity, do you see more issues earlier on, or they happen more in later childhood, or is there any particular age range that you seem to see a lot of things bubbling up at?
We primarily see things usually between first and fourth grade.
Okay.
Sort of the key areas. It used to be a little later, but more third, fourth, but the school curriculums have pushed things down as far as when kids start to read and the amount of reading that's expected of them. So we're seeing more first, second, third graders now coming up with significant school struggles that appear to be related to their vision.
Okay. For a child specifically, at what age should a parent really start to bring children in to see you or someone like you?
Well, it's not a bad idea. There's a few things here. Number one, there is infant vision. Not a bad idea to get a child checked sometime between 6 and 12 months of age. There's a special program for that called Infant C.
Okay.
The word infant, S-E-E,
Yep.
that they can look up online and learn about. That does free infant screenings. After that, age 3, age 5, and then every year thereafter that would be really ideal.
Okay. So you had mentioned, but we had talked about before, there's definitely a difference between eyesight and vision. When a child goes to, or when anyone goes to an eye exam, what type of things don't come up in that type of test, or that even if you might be 20/20, but or the test doesn't really indicate a problem, what type of problems would bubble up in spite of that?
Okay, well, like I said, if you had just a sort of a routine eye screening, a lot of things are going to go. You'll probably get a good eye health assessment and be checked for what lenses you need, especially for distance viewing. What's not going to come up, I'll use one example, is for about 1 in 4, 1 in 5 children, the act of aiming their eyes up close is not easy and effortless. So most of us, we're fine. We look at a book, it's clear, it's single. But for a certain percentage of children, the act of aiming the eyes inward so that the print is clear and single, especially, is a real strain. And what happens is this is really hard for them. So what happens is they hold it for a few seconds and then they lose it. And so what happens is the print starts to run together. It may move around the page, may come in and out of focus. Kids say that the print may float around or the letters jiggle. They may just get a headache. And these are very, very fixable vision problems. The unfortunate thing is most children think they see things the same way everybody else does. So they're not going to say, gee, Mom, I see double when I read. They're just not going to like to read and get frustrated.
All right, that obviously will have a serious impact. Hopefully that should be caught fairly early on. It is pretty significant. But now kind of moving towards the area of what we really more want to focus is really the learning part of it. So how does vision relate to learning that you see in the kids or the adults who come into your area?
Okay. Well, science shows that about 80% of what we learn comes in through our eyes. Okay, we have our classrooms are very visually set up. We have blackboards, we have books, we have desks. So we're really heavily reliant on good visual abilities to function in the classroom. So as I said before, a child whose, let's say, eyes are not working well together, what's going to happen? Well, they may start out okay in first grade. The print's pretty big.
Right, exactly.
And they may seem to be doing okay. And then they get to about second grade, and the child who we thought was a good early reader is now starting to avoid reading. And they may show a number of signs. They may complain of headaches when they do close work. They may get very close to the page. They may tilt or cover an eye or close an eye. We've seen some kids do some really interesting things to just avoid. One of the big symptoms is once they start getting homework, they find that 20 minutes of homework takes hours to get through. So, and then the parent calls the teacher and say, "Why are you giving so much homework?" And the teacher says, "No, I gave you a 20-minute sheet. It shouldn't take that long." And then the mom is wondering why this is a fight every night and it's taking them an hour or two to get through it. And very often in cases like that, the vision really needs to get looked at.
Is there any particular conditions that vision is also a contributor to in some way, that anything that you come across regularly?
One of the things that it's really often confused with, it's a big hot topic, and that's probably a show unto itself with maybe some other experts, is ADHD. The symptoms of vision problems and the symptoms of ADHD, attention deficit issues, are actually, there's a big overlap. They're very, very similar. The child who can't sit more than 5 minutes at the desk gets antsy, can't move around, can't stay still. You see reduced reading comprehension, distractibility. And though these symptoms sound very much like one, they also sound very much like the other. So they did a study a number of years ago at a San Diego medical school, and they found out that children who have ADHD have triple the incidence of these convergence problems as the general population. So you can have ADHD with or without vision problems, and the other way around.
Wow, so your ADHD could be, either not like entirely or very significant part of that would be vision. It wouldn't be anything necessarily beyond that.
Absolutely. We had this was actually a good story. A child who was having a lot of ADHD issues in third grade came, and over the summer we successfully treated their vision problem, their ability to use their two eyes together. And then when the mom had the first conference with the new teacher the next year at school, the teacher was very confused because she saw all these notes about ADHD and thought that last year's teacher must have been mistaken, because that child was now one of the best attending, performing kids in the classroom. So, so in that child's case, it made a huge difference.
Yeah, that is. So what are the components that, or at least the visual components anyway, that you really need to really have to progress through school that you can think of?
Okay. Again, well, we have several different classes of visual abilities. The first one, of course, we need the eyes to be healthy and intact. That's done at any routine eye examination. And we have our visual acquisition skills. That's getting the information in. So we have to make the print clear. We have to make the print single, and we have to be able to find where we want to aim our eyes.
Right.
So, because if you get lost on the page or are not linearly reading from word to word or line to line, it's all garbage anyway. And I use the term garbage because these are our garbage in, garbage out vision problems.
Right.
So that's the acquisition, getting the stuff in. How well does it get from the get to the retina, and is it clear? Is it single? Have we moved where we want to be? So that's visual acquisition. The second part is our visual processing skills. So now it's gotten to the brain. It's gotten to the visual portions of the brain. Now you have to remember what you've looked at.
Right.
You have to understand what you're looking at. You have to pick out what you're looking at from the background. There's about 20 or so visual abilities that affect reading and learning. And part of our testing is we have a battery that does this. But you have to understand it, pick it out from the background, remember it, remember what it's called, give it a name. That's a green cup, okay? So I have to be able to recognize it and use my memory to process it. And then I have to act on it too. So write me a paragraph about a cup on a table. So now I got to remember what I'm seeing. I got to visualize it in my head. I got to make my hands move in a specific way. We call that output.
Okay.
And it directs action. And so it's the same things that enable you to do this are important. We think of it every day. We see it all the time in sports, catching a ball. You have to look at it. Your brain has to calculate when to move your hand to catch it and do that. These same abilities get you through the classroom day as well. So.
You mentioned sports. Do you work with athletes at all?
We actually have worked with athletes. I'll put a plug in. I've actually worked with the University at Albany girls volleyball team. We've worked with a number of their players. That's a Division I, very high caliber, and I've developed a good relationship with them, and we've had some very successful cases go and do very well. Sports vision, I have a friend in Buffalo who works with NHL goalies on a regular basis. I have a friend in New York City who has worked with several professional athletes as well. So sports vision it's a hot topic. It's getting a lot of attention and research now. There are some articles about it in various sports magazines. Even golfers are getting vision therapy.
I can see particularly a hitter or a batter. I can see that being a really area that could use help in. So vision therapy specifically, you just mentioned it. So what exactly is vision therapy?
Well, as I said, we have all these different visual abilities, and the thing about them is they're not just innate. They're things you learn how to do. So when an infant is creeping and crawling and playing and doing, they're developing these nerve pathways in their brain that help them, again, move their eyes the way they're supposed to and understand what they're looking at. So since vision is a learned process, you can develop new pathways at any age. So vision therapy is a individualized program, a therapeutic program, where we break vision down into all these different visual skills and abilities, focusing, moving, eye teaming, and we teach you and train you how to do them effortlessly, and how to do them under even stressful conditions. So we might have a ball suspended from the ceiling at eye level, and we have the person follow it as it moves in a circle and do that one eye at a time. We may have a ball with letters on it. So now, to make it harder, why don't you read us the letters on the ball while it's moving around? Now they're not just watching a 3-inch ball. Now they're watching, 1/4-inch high letters as they're doing it. And then we'll make it even harder. We'll ask them to say a letter every time they hear the beat of a metronome, or to do it while they're balancing on an unsteady board, or to do it while we're trying to distract them while doing other things. So this way, then keeping your eye on a ball for sports or on the board when you're copying now becomes an easy task, because we've given you much more difficult things to do than that.
Just out of curiosity, that type of a reprogramming, it seems like it's almost, is it easier to do that with younger, older kids, adults?
I will say this, theoretically, it's easier to do it on young kids. Kids' brains are wired differently. They're wired for learning. Kids often learn things much quicker than adults. There's something, a hot topic now in science is brain plasticity. That means how malleable and changeable is the brain. Once upon a time, they used to think once you were 6 or 7 years old, the brain was set and there was nothing that you can do to change things. But the current research has shown that absolutely the brain has the ability to change and make connections and to even develop new cell pathways all the way through the end of life. We see a lot of patients who've had strokes and brain injuries in their 60s and 70s, and they go to various therapies such as occupational therapy and physical therapy, and they're actually learning to use different parts of their brain to take over for injured parts of the brain. So that brain plasticity is definitely better in a child. However, I will say this, adults are very motivated. And some of our most successful cases are the adults, because they know why they're here. Johnny, who's 7 years old, doesn't always get it. Mom
Right.
brought him in, said, you need to go see Dr. Fox and go see his therapist and do your weekly therapy over there. They don't really get it. But we have somebody who maybe is working on a computer and getting some double vision or headaches, or going home with severe sort of burnout as far as their vision goes every day. And we tell them what needs to get done. And they're great. They're motivated. They come back and they go, well, I'm doing these home exercises, 3 times a day. Is that enough? And I go, once or twice a day is good. So we've had equal success, I will say. Often what the adult lacks in plasticity, they make up for in motivation and enthusiasm. Yeah.
Has vision therapy been around for a while, or is it new, or is it?
It sounds new. Vision therapy goes back to 1928,
Oh, wow.
believe it or not. So we're actually starting to come up on our 100th anniversary. The first father of our field was a doctor named A.M. Skeffington, and he was the first one to put the connection between stress and vision together. He had a number of patients who had changed occupations to now doing a lot of paperwork, and they started to complain about various headaches and discomfort while doing things. So he started analyzing this, and then in the 1940s and 50s recruited a lot of people from other fields, psychology, medicine, etc., child development, education, and got them all to work together with a common goal of what can we do to help these children. So it's really, we're seeing increased interest now. We've had some people, like I said, pro athletes. We have we've seen it in sports. We've seen it now in neurorehabilitation.
Okay.
Brain injury is a hot topic now in our field, and areas such as brain injury rehab, encountering a lot of patients with vision problems, and optometrists like myself have had a lot of answers for them. So we're seeing sort of an increased interest that we hadn't seen in a long time.
And just in that brain injury situation where someone actually had some kind of trauma or damage to the brain, you can relearn vision basically over again.
Yeah. Actually, over half of them have significant vision problems, which is pretty high.
Yeah.
And just as I said, in the child, the most common is the eyes not working together. That's actually the most common for the brain injury patients too. They have sort of an outward drifting of their eyes. So many of these patients start to encounter double vision, headaches, can't read anymore, difficulty driving, things like that. Some respond very well. Again, there's such a wide range of severity of the brain injuries that it's tougher to predict how well they will do compared with the children, where we can make excellent predictions. But we've been able to help a huge number of them. I am on staff at Sunnyview Hospital in Schenectady, and I see once a week I go in there and I see brain injured patients, and we have a lot of success helping them.
Okay, that sounds great. So you said the field actually was started back in 1928. So how much research do you have is behind some of the things that you're doing, either specifically or kind of overall?
Yeah, the research actually lately has been outstanding. There's I think clinical work tends to precede research work. Clinicians do things and then the researchers back it up. There was an article a number of years ago by a group called the Convergence Insufficiency Treatment Team. They did what's called the gold standard study, totally double-blind, centers all over the country, including the Mayo Clinic. So, and they showed the connection, the efficacy, the effectiveness of vision therapy to treat convergence disorders. And we've had studies like this going on now. There's other ones in the works that we hope to see soon. There's been a lot of studies all over the world. Some of this good stuff comes out of Europe and other places. And the connection between vision and learning and reading seems to grow stronger every day.
Generally speaking, what's involved in a good vision therapy program? Is there any generalities you can make across modalities or anything?
What the research has shown, is that getting back to the research, is for a long time, people said, convergence problem, you could treat that at home. You don't really need a doctor. You could take something like a pen or a pencil and just practice looking at it,
right.
and that'll fix it. And what the research has shown us is actually just the opposite, that once a week office-based therapy, and that's typically how things are set up. Our children and adults come in, our patients come in once a week for about an hour of therapy. We give them practice. We don't like to use the term homework. They get enough of that at school. So they practice the rest of the week at home, 10, 15, 20 minutes a day. We don't demand a lot. People are very busy. And typically a program will last usually 6 to 9 months in length. The research has shown that to be quite an effective way to do things, whereas the home-based activity of just looking at, let's say, a pencil and just seeing the doctor once a month or so was actually shown not to be any more successful than placebo therapy.
Wow.
So something that a lot of people are still doing, because I know patients come in and tell me and show me the sheets how to do it. I know it's still being done, but the science is showing just the opposite, that a real intensive office-based therapy is very, very effective in treating these conditions.
Once you have this type of therapy, and I believe you said it was like 6 to 9 months it typically lasts. Does this last for a lifetime, or do you have to keep coming back periodically to to update, or not to update, but I mean just to basically keep with the conditioning that you did in the 6 to 9 months?
Yeah. Well, I will say by and large, I won't say always, but by and large, once you've learned how to do these things, you know how to do these things. It's sort of like once you've learned how to ride a bicycle, you know how to ride a bicycle. So once you've learned how to use your two eyes together, it's generally a skill that stays with you. Again, a little different. We have our brain injury patients who will often need to keep doing therapy. Again, they're wired a little differently.
Right.
Things have changed in their brain. But I will say almost all our patients are able to maintain their abilities. We've had patients show up years later, and they generally are doing pretty well. There are a few conditions that are a little tougher to manage, and that may change as kids go through some growth spurts. Things may change, and we may need to do a little tune-up. But generally, we see very good success down the road. We've had these kids come back years later, and they tend to keep doing well.
Okay, great. Just really quickly, does insurance cover this type of?
I'm going to say yes and no.
Okay.
It's a case-by-case thing. We find that this is generally treated more like orthodontics, like braces, where it's often an elective thing that they have to do, where they may have to take care of it themselves and then try to collect themselves from the insurance company. Some insurances do, some don't. There's too many different cases out there for me to talk about. But like I said, generally we tell the parent to expect this to be like braces and to be prepared to pay for this themselves, and you will have to make the decision yourself. We generally don't contract with the insurance companies, so we'll leave that to the parents to discuss.
What do you, just from a standpoint of this field, what do you see coming down the road in the next 10 years that might be new or different than anything than what you're doing right now? Well,
we're seeing technology really get in. A lot of the same, there is actually an excellent study, I don't know how excellent, I didn't read the whole study, but there was a report of a study using some of the new 3D technology you're seeing now on the commercials on TV, all these virtual reality goggles. We're starting to see that get into our field, and There's the possibility that that may help train some of the more difficult conditions to treat, specifically things like amblyopia, which is a lazy eye. Hate to use that term because the kid's not lazy, or strabismus, which is a turning eye. So we're seeing some new technology really coming down the pipeline here that can add to our arsenal of equipment and techniques to hopefully even be more successful at treating some of the more difficult vision problems.
Yeah, what do you like personally about your job the most, and working in this field? What's the most satisfying?
You know, we change lives.
Right.
I'm going to say that that's most satisfying. We had a kid. I mean, most of our patients, as I said, are sort of 7, 8, 9 years of age, and it's great to see a kid who's taking 2 hours of homework. And I ask Mom, how's homework now? And they go, oh, he did it on the bus on the way home. Because we've seen some of these kids, like, what does your kid like to do? Does he play soccer or anything? Well, we had to give that up because homework was taking so long. And to find out that now they're playing soccer or ice hockey again because they have time, that's great. Another story was a little older kid, because we don't see quite as many of them, but there was this young man, I'm going to say, he was a 10th grader, and he was having significant emotional problems and behavioral issues, and was now being put in foster care, and major problems at school, and flunking 10th grade.
Right.
And at the end of therapy, 11th grade, he got 90s. And he started talking about how he wants to go to college now.
Wow.
And he was now a presentable, articulate, just well put together person, and almost couldn't imagine how a year before he was such a mess, and was probably not going to complete school, probably headed towards being a dropout and maybe worse.
Yeah.
And it was nice to hear how he had a bright future now.
Well, that is a great story. All right, well, I think that pretty much wraps up the content we were looking to provide. We provided obviously a lot of good information on vision and vision therapy specifically. So I want to thank Dr. Fox for coming in today and taking time out of his schedule on this very cold day. And I want to thank you for watching. So I hope you tune in next time for the next edition of Health and Wellness. Take care and have a really great day.